Good afternoon, everyone, and a blessed and reflective Good Friday to all of us. I do wish every citizen and resident of this federation a successful and spirit-filled Triduum. For those of you who do not know what that is, the Triduum is referred to as the 3-day period, starting from Holy Thursday, which is yesterday, going through today, Good Friday, and then, of course, the vigil of the Easter, which should be celebrated on Sunday. So that is something that we look forward to, since we are predominantly a Christian nation, and by that extension, we are considered an Easter people. As of Friday, today Friday, at 3 p.m., the WHO reported that there were 1,521,251 confirmed cases of COVID-19 globally, with a corresponding 92,798 deaths. In the Federation to date, we have tested 205 persons with now 12 confirmed positives. And that is to say that we have, as of today, an additional confirmed case of COVID-19. And of course, the individual is an Indian national who happens to be of the age of 21 years old, and that is our most recent one. Just last night, we would have received a number of test results, 23 in total, of which 22 were negative, and the one positive that I just mentioned. So we are grateful to God that we had only had that one among that large number of results. Our 12th case, as I said, is a male individual, and he would have had direct contact with an announced case, a previously announced case that we would have divulged to the public some time ago. The individual, for the information of the public, had been placed in quarantine since the 29th of March, when he was first named a contact of a previously confirmed case, and subsequently he would have been sampled and tested. And of course, this was able to be done because of the aggressive contact tracing that we have put in place. So it now means that this individual would now be in mandatory isolation, which is more stringent than the previous quarantine situation that the individual would have been in. As such, there are 29 persons who are quarantined in a government facility, with 159 persons quarantined at home. 12 persons, as it would make sense now, are in isolation because we now have the 12th confirmed case of COVID-19. To date, we have released 470 persons from quarantine. We are reminding our citizens and residents that our community health workers are still in the process of tracing and monitoring persons who would have had contact with confirmed cases. And this is done in an effort to reduce the possibility of community spread or community transmission, so that we take those persons out of the general population as soon as possible, put them under quarantine, and then in the event that they become a positive case, at least you would have already removed them from the general population. So that type of aggressive approach is what has contributed to the low numbers, the relatively low numbers that we have had thus far. The Ministry of Health would like to thank the citizens and residents of our Federation for their continued support and for their understanding in terms of the measures that we have been putting in place, both the Ministry of Health and the Ministry of National Security, to keep everyone safe. And we're reminding individuals that we have to work together if we are going to come out of this thing in a fairly good condition. And to remember that one of the ways in which we do that is by exercising strict social distancing and appropriate respiratory hygiene measures. And again, when we say appropriate respiratory hygiene measures, we are talking about the preference in terms of wearing a mask on the outside. Dr. Wilkinson, the previous speaker, went quite in-depth in that, so I don't need to repeat that. And of course, in a prior session, he would have also given examples of what to do if you have to cough or sneeze, using a tissue, a handkerchief, discarding of whatever it is, or doing it in the crux of your elbow. It is important that we remind you that a person with a confirmed diagnosis of COVID-19 is expected to remain in strict isolation. And of course, We would also make sure that anyone who has had direct contact with that confirmed case would be placed in quarantine. And when you're in quarantine, you're not allowed to interact with anyone for 14 days, which is the average length of an incubation period. We will continue to give you these updates via this particular national forum, and of course some of it will be posted as time goes by to update the information on our official COVID-19 website, www.covid19.gov.kn. You're also reminded that if you have questions and concerns, you're free to call the hotline, which is 311.